Hello, and welcome to Science on the 7th, a virtual space where we talk about a lot of different issues related to air quality and health. I'm your host, Pallavi Pant. As some of you may know, earlier this month we celebrated the fourth Global International Day for Clean Air and Blue Skies. So there has been a lot of attention and focus on the topic of air pollution in recent weeks, a lot of events, a lot of activities happening around it. And Sunday, September 29th, is World Heart Day, a day where, again, there is attention and focus on heart health. Many of you may know that air pollution and exposure to air pollution can result in a lot of impacts on our respiratory health, on our lungs, on how we breathe, and diseases like asthma. But did you know that air pollution exposures are also responsible for impacting our heart health? I'm very excited today to be welcoming Dr. Mark Miller, who led a recent World Heart Federation report on exactly this topic. How does air pollution impact cardiovascular or heart health? He's a senior research fellow at the Center for Cardiovascular Science at the Queen's Medical Research Institute at University of Edinburgh in the UK and has worked on this topic for a long time. Welcome, Mark. We are very excited to have you on here today.
Many thanks, Pallavi. It's great to be here.
Thank you. And for those of you who may be listening in, if you have questions for Dr. Miller, please pop them in the chat and we'll try and get to them towards the end of our conversation. But Mark, let me start by first congratulating you on this huge report that came out a few months ago. It is, still doing the circles. A lot of people are still talking about the messages. And I think we have a visual of what the report looks like. But let me ask you this. What are the main messages that you're trying to convey with a report like this?
Yeah, thanks very much. So as you can probably see from your screen, so the report is the World Heart Report, and it's a major report from the World Heart Federation, and it's released annually on a different topic. And this year I was really pleased that the subject was on air pollution and cardiovascular health. And I think you've covered it already, but I'll probably say it again anyway. I think we are getting to a stage where people are more aware of the harmful effects of air pollution, but probably I would still say that the appreciation is still woeful. It's really underappreciated. When you look at air pollution, it's the number one environmental risk factor. But it's also, if you look at recent global burden of disease data, it's right up there. It's within the highest and the second highest risk factors for all different causes of mortality and morbidity. And the scales are amazing, as you probably mentioned in other episodes. We're talking 7 to 9 million premature deaths every single year. Absolutely staggering numbers. So this report in particular wants to focus not just on air pollution, but on the cardiovascular effects. And you've said quite rightly, when people think of air pollution, they think of the effects on the lung. They imagine somebody coughing, for example, or having an asthma attack. And that's reasonable. I mean, air pollution does have really severe effects on the lung. But actually, if you take the mortality that's linked to air pollution, so the deaths that are linked to air pollution, and you look at the causes of deaths, you may be surprised to find out it's actually 70% of the deaths linked to air pollution are due to cardiovascular conditions. So that's heart disease and strokes. So while strokes are something that affects the brain, they're actually caused by cardiovascular problems. And it's these things that really have such a big impact on our health because cardiovascular disease is so widespread around the world. So this is what we wanted to highlight in the report as well. So we took World Health Organization data, the most recent we had access to at the time of writing, which was in 2019. And essentially we did a reappraisal. It's very, very hard to sort of pull out just 2 or 3 key messages. So instead, let me just give you a sort of selection of some of the statistics. I mean, the first thing to say is just looking at air pollution itself. So we assessed what air pollution was like around the world and how has it changed over time. And the good news is that air pollution is falling. So when you look at the major air pollutant that's linked to health effects, that's PM 2.5, very, very fine particulate matter in the air. That's actually falling, but it's only falling a small amount. So for the last 10 years, it's just decreased by about 1%. So it's not a lot. And also in some regions of the world, it's increasing. And we have countries where we're still seeing levels where more than 10 times the World Health Organization guidelines. So we do have a major problem across the world we need to tackle. As I said, the good news, though, is it is falling. And actually the mortality, when you look at the age standardized mortality, so you look at mortality rates, they're falling because the air pollution is falling. What we have to bear in mind, and what the report tried to highlight, was that we have a growing population, we have an aging population. And so because of that, if you look at the actual numbers of deaths that are caused by air pollution, they're still on the rise. And perhaps if I just focus really on the real headline figure from the report, as I said, we're looking at cardiovascular conditions. And the shocking figures are that in 2019, this single air pollutant, PM2.5, was linked to almost 2 million deaths due to heart disease and almost 1 million deaths from stroke. So just two conditions, and we're having millions of deaths. It's really shocking figures, no matter how many times I've talked about them. But it's perhaps even worse than that as well. Remember, we're talking about one air pollutant and two conditions. Well, what we did also for the report is we looked at lots of literature, lots of background research, and we could find evidence that a whole range of different air pollutants had a whole range of adverse effects on many cardiovascular conditions. So really, these really shocking figures are still underestimates. And all in all, it just means we need to raise our awareness more. We do need to accelerate our efforts to tackle this problem.
Yeah, thank you for that overview. And, absolutely, I think some of these numbers are just so stark. Said 2 million deaths just linked to heart disease in one single year. So that's a huge disease burden and also, a public health problem that many countries are likely going to be facing. And I'm sure you get this question from a lot of people already, but often when we say that air pollution is linked to poor health, is linked to, heart diseases or respiratory diseases, often people ask, but how do you know this? And do you know how it works in our body? Like, why is this happening? And you mentioned that, there was a lot of literature surveyed in preparation for this report. I'm wondering if you can talk us through a little bit about how air pollution really impacts the heart. And we've pulled, I think, a schematic from a recent publication, which, according to me, lays it out really nicely. But I'll let you walk our listeners through a little bit of how, when we breathe in air pollution, how is it really impacting our heart?
Yeah, it's a great question, and it's one of my real passions. So we do a whole range of research at my own research institute in the University of Edinburgh, and we cover a range of different sort of techniques. But I came in to really sort of understand the biological mechanism. So what's the pieces of the jigsaw that link up to the air pollutant in the air to having all these effects that are causing cardiovascular disease? There's no simple answer, I'm afraid. It is phenomenally complex. And that sounds like a bit of a cheat, but I think it's important to sort of understand that if we can actually find out how these pieces of the jigsaw puzzle fit together, they can really help us. They can tell us who's the most susceptible, which air pollutants are the most harmful. So to answer your question, it's really saying, how do we go from breathing in air pollution to the effects on the cardiovascular system? And I'm perhaps just going to focus on the right-hand side of the diagram that's on your screens here. So what do these air pollutants actually do to the cardiovascular system? And they do many, many different things. Firstly, some of the key sort of processes that go on are processes called oxidative stress and inflammation. So these are technical terms. The best way I can describe them is oxidative stress is a bit like the body rusting, just as something like a metal would rust in the rain. Oxidative stress is effectively what encourages our body to age and rust. And then we have inflammation. And inflammation is a process that helps defend the body. But what happens is when we have disease, it gets out of hand and it becomes deregulated and it gets a bit out of control and then actually damages the body rather than protect it. So these are involved, and air pollution does this at many different steps throughout these processes. But if we looked at the right-hand part of these diagrams, so what's it doing at the level of the heart, the blood vessels, and the blood? So if I say the heart, first of all, if we breathe in air pollution, it changes the way the heart functions. It changes the heart rate. It makes the rhythm of the heart change. It makes us have an abnormal heart rhythm. But it also makes the heart more susceptible to damage. So if we have a blocked blood vessel in the heart, which is something that could trigger a heart attack, for example, this is because the blood vessel's blocked and we can't get blood all around the heart, and then damage happens to the heart. Well, if you breathe in air pollution, that damage gets a lot worse. So it's almost like the heart is sort of not prepared for the damage anymore. It can't protect itself as well. That's the heart. In the blood vessels, what it does is it stiffens the blood vessels. It makes the blood vessels less able to relax. So blood vessels are not just tubes, they're an active organ that relaxes and contracts, and we need that. That controls the flow of blood around the body. And so if it can't do this as well, for example, when we breathe in air pollution, it doesn't regulate the blood flow as well. And it also increases blood pressure, which is a major risk factor for disease. And then long term, it causes vascular disease. So all of us at some point, unfortunately, will start to get fatty plaques build up on the inside of our arteries. And that's really the major cause for a lot of cardiovascular diseases. And what happens is that air pollution makes these plaques bigger and it makes them more likely to rupture. And then finally, just to touch on the blood, it also, when you're exposed to air pollution, makes the blood a bit stickier, makes it more likely to clot. The body can't clear away blood clots very easily. So I mentioned lots of different things there. And I think the ultimate way of summarizing it says that all these different long list of effects that I've said would make a healthy person more likely to develop cardiovascular disease. And if you're a patient who already has cardiovascular disease, then it would make you much more likely to have a heart attack or stroke. So air pollution, unfortunately, has many different ways it can cause harm to our heart health.
Great. Thank you very much for walking us through this. And, as you were speaking, and of course, having looked at some of this literature already, one of the questions that people tend to ask, and probably this is a question I would have as well, even though I work on air pollution. My father, for instance, has had heart disease. He's had treatment done, and he has lived in some of the most polluted places in India over the course of his life. So when researchers and scientists and medical experts are talking about these health effects and the way that inflammation and oxidative stress may lead to these impacts, what is the type of research that has been done to come to those conclusions? Are we following people over long periods of time? Are we testing them in laboratories? Like, what are we doing that gives us this information and, tells people how these stepwise processes are happening?
Yeah, that's a great question. And I think it's important. Ultimately, we need to know what's going on, but actually how we know what's going on is important. Because I think even though people are aware of the cardiovascular effects of air pollution, there is still some skepticism. There's sort of, do I really believe it? Is it due to something else? But actually, if you start combining all the different scientific approaches together to build up this jigsaw, that's when you can be a lot more certain. So the epidemiology, the population data studies tell us a huge amount, and they give us these headline figures, which are great. But if you can start building in the other scientific approaches, you can get a much bigger idea of the story. So perhaps let me give you an example. I'll probably give you a long example. I'll try to watch my time. Please do hurry me up. If I go back to some of the research we do in Edinburgh, one of the things I'm lucky to have in Edinburgh is we do research of all different types, all the way from cells to animal models to human exposures. And let me give you a few examples. So one of the real problems of this and sort of believing this field is sort of imagining how does it happen? How do air pollutants that are breathed into the lung then go to affect the heart and the blood vessels? And there's this gap, isn't there, from the lung to the cardiovascular system? And that was one of the big problems that has taken us many decades to work out. So one of the theories when I came into this field in 2005 was that essentially what's happening is the lung tries to defend itself against air pollution, and it causes inflammation. And this inflammation builds up to such an extent that it becomes overactive, and all these inflammatory cells release mediators that damage the body, and they spill over into the blood, and then they're carried to other organs. So remember, this was just a theory at the time. So you can do some experiments to try and prove that, and we did a study with cells. So you can take inflammatory cells and you can expose them to a certain air pollutant, like a particle that comes out of a diesel exhaust engine. And when you do this, it overactivates the inflammatory cells to such an extent that it releases things, and then it passes on that inflammation to the cells of the cardiovascular system. It inflames those too. And these experiments really showed us that actually the inflammatory cells really amplify the effects. So it's not just a case of having the damage caused by the particles of the air pollutants itself. There's these processes in the body that really amplify things, but it doesn't quite explain everything. One of the other theories we tried to tackle was that if you have air pollutants inhaled into the lung, they actually stimulate sensory receptors on the lung. And these trigger neural pathways, and they trigger changes in hormones, and they could account for a lot of effects. So again, you asked about types of experiments. you can use animal models to model complex diseases. So you can model, for example, what happens when you have a heart attack. And when you expose the model to the air pollutant, what happens is you get the damage to the heart, and this damage is much bigger after exposure to the air pollutant. But if you add in drugs that block these sensory receptors or dampen down these neural pathways, you don't see that damage anymore. So we know that the neural system is regulating some of these effects. So that tells us something, but again, we need a little bit more. It explains the heart effects very well, but maybe not the other effects. So the last sort of pathway, and I will stop after this one, I promise, is really one that was quite an emotive pathway, and it's now quite accepted in the literature, but it wasn't at the time. And that's that for the very, very smallest particles in air pollutions, and we're talking smaller than many different types of air pollution like that comes out of a vehicle exhaust. They're so small, they're smaller than viruses. So because they're so small, can they themselves pass into the blood? And once they get into the blood, they can pass all around the body. So for this study in ENVI, we used a slightly different approach, and we actually did this work in humans. So we can actually do experiments where we have human volunteers that will breathe in air pollutants and pollutants in very safe conditions for a short period of time, and we can monitor the effects in the body afterwards. And we have managed to find some volunteers who are happy to breathe in a very small particle, and we could start to see that particle appear in the blood soon after they'd inhale it. So it does say that these particles can get into the blood. The shocking thing was that these particles don't just get into the blood. Once they're in the blood, they're carried around the body, but they start to build up in our blood vessels, and they start to build up in the blood vessels that are inflamed. They start to appear in these plaques that I mentioned earlier on. So it's almost like these particles are designed to cause as much harm as possible. Not only do they get throughout our body, but they're almost like targeting the areas where they're going to cause the most harm. So you can see how you can integrate all these different methods together, and you can piece together the jigsaw puzzle. And really, this tells you, that there is such a huge body of evidence from all the different angles, and the data is convincing. I think that no longer we can just pass off and say air pollution, it's a problem. We now know why it's a problem, we know how it's affecting the body, and it's time to do something about it.
Thank you for walking us through that. I think it's fascinating, also because a lot of times people see these big headline numbers, 2 million deaths, and they wonder, how did you get to 2 million? How do you know it's 2 million and not 1 or 3? And clearly there is a lot of science and scientific research that is happening behind the scenes to come to those numbers. So thank you to you and the many others around the world who continue to do research on this topic. Coming back to some of your main messages, the fact that air pollution is really contributing in a significant way to cardiovascular health. We see this with every other, category of risk factors, that some places, some regions, some countries are more impacted than others for a variety of reasons. So when it comes to the disease burden linked to cardiovascular or heart health, where are the places where we see the largest impacts? Where do we need the most urgent interventions today?
Yeah, and that's another great question as well. I mean, the first thing to emphasize is this is a global problem. So it doesn't matter where you are in the world, we're all breathing air pollution that's above recommended levels. And it's not just recommended levels. These recommended levels are based on the health effects. So these are the levels we can still see effects on our health. So no matter where you are in the world, you will have air pollution affecting your health, it's sad to say. But probably the largest burden really tends to be lower middle income countries. And that's really because these are the regions that tend to have the highest air pollution. And that's not only just across the whole of the region itself, but many of these low middle income countries that are sizable have megacities. So not only do they have extremes of air pollution across their country itself, but there are real hotspots of air pollution. And these also tend to be where people are most populous as well. The other things that are a concern, I think, for low middle income countries is I've talked a lot, mostly from the sort of topic of, or the focus of outdoor air pollution. We shouldn't forget indoor air pollution. So in things that happen in the household or in occupations as well. And in lower middle income countries in particular, we have a problem with solid fuel burning, and these generate many harmful air pollutants. And these do have a huge burden on health. And many studies have shown that this affects in cardiovascular health. And I think what's really worrying about this is that these are some of the countries which have the least capacity to try and protect themselves. So they have the least capacity maybe to try and lower their air pollution levels. They're potentially the countries where many individuals have poor access to adequate health care as well. So all these things are compounding it to have a greater toll on health. I think one of the things we draw attention to in the report as well is we need better monitoring of air pollution in low and middle income countries. We highlight Africa in particular in the report. So Africa is, it's a huge continent with a big population, but it actually has very, very poor monitoring of air quality. You can assess this with satellite measures, but really the best way to do that is by stationary monitoring networks on the ground. And it's amazing to find that just a few countries in Africa have monitors for air pollutants, and even ones that do can only measure 1 or 2 air pollutants and not necessarily reliable. We need to improve that monitoring in these countries, not only so we can get a full idea of the burden on health, but also really because that will help us address which are the best strategies to try and intervene and how effective those strategies are. So certainly air pollution in low and middle income countries is a topic that needs greater attention.
Yeah, that's, I think there's a growing sort of consensus about the need to really address the topic of air pollution in low and middle income countries. And we've also seen this from some of our recent work. We published a global report on air quality and health in partnership with GPD. And we find that the biggest impacts, in fact, are in parts of Asia, parts of Africa. And those are the places where we have least amount of data, the least amount of investments happening. So hopefully we will continue to see progress on that front. But one of the other things which has really risen to the top of people's minds, especially in the last couple of years, is, how is climate change playing into all of this work? We've seen extreme heat events, more extreme heat events than before in more locations than before. We're seeing wildfires in many parts of the world, again, lasting for days, exposing a lot of people to air pollution. And I want to pull up this graphic that I believe is from a recent paper you did with some other colleagues. How do we know and what do we know about the impact of the changing climate on heart health? How are these, wildfires and other extreme events, weather events, going to impact air quality, and how are they going to impact our heart health?
Yeah, it's a huge pressing issue. And while air pollution and climate change are not the same thing, they're almost like two sides of the same coin. So global warming has the potential to increase air pollution. So it makes the ground more arid, it reduces vegetation, and that will encourage airborne dust. Also, there is the higher risk of wildfires from the dry vegetation. So not just the risk of wildfires, but also the severity of wildfires. And wildfires can lead to huge plumes in air pollution, which can travel many kilometers far away from the source. So we can travel from, for example, forest areas to megacities thousands of kilometers away. So that's a problem. Also, we have greenhouse gases interact with each other, and they interact with other air pollutants and the increase in temperature, and they can form other air pollutants. So some greenhouse gases can form ozone, and that's another air pollutant which we know affects health as well. And then the counter is also true. So we have air pollution can actually worsen global warming. So if we have particles that are made from combustion, from burning, they contain black carbon, and black carbon absorbs heat and it can trap heat towards the ground as well. So there's sort of a vicious cycle. They're interacting with each other to worsen each other as well. And we do know that, unfortunately, that both heat episodes and air pollution, they both have cardiovascular effects. And some of those mechanisms by which they do so are the same. So even it could be the case where they're having synergistic effects to make the effects on heart health even worse. I did mention just at the start of the question that they aren't the same things, and we do need to be careful. We need to understand the science so that we don't get the two confused with each other, because there has been episodes in the past where there have been strategies to try and reduce climate change through interventions, but have potentially led to worse air pollution. So we need to be a bit cautious and understand the science. But I think one of the positives of the message is that you can tackle certain sources of air pollution like fossil fuels, and that will benefit both it will get rid of some of the most harmful air pollutants, and it will help tackle climate change as well.
Yeah, that I think that is a good message. There are sources that are common to both that can help us in addressing the two problems. And looking at your body of work over the last 20 years and more, it's clear that you've been a leading voice on both the science behind air pollution and cardiovascular health, and also talking to people about it, especially your work in the last few years with the World Heart Federation. I'm curious, cardiovascular health in itself is such a big problem. There's a variety of risk factors that influence it. And of course, people work on many aspects of cardiovascular health. What got you interested in the air pollution piece? And, how have you seen things change? And what's giving you hope that we're going to see progress?
Well, that's a great question. Thank you very much for the compliment. I probably shouldn't admit it, but I got into this field rather by chance as well. I originally trained as a pharmacologist, looking at drugs that affected cardiovascular health, working on blood vessels, for example. And it was really by chance I was recommended to work for some cardiologists who were putting a program together on air pollution in the cardiovascular system. And then you need someone to try and look at the different mechanisms for the reason I've said. And that was my specialty at the time. And I have to be said, at that time, I wasn't sure whether to take the position. I was having senior colleagues saying, no, you should do something more state of the art. You should be doing molecular biology techniques. You should be moving to different countries as well. And being a stubborn Scotsman, I ignored that advice and I went to work with them. I knew the people were excellent. I knew the project was excellent. And so perhaps that's a word of encouragement for junior researchers. Always listen to your colleagues, but also take into mind other factors as well, because I was certainly lucky enough to find the field that I'm passionate about. I knew nothing about air pollution, but I wanted to do something with a real world impact, and I was interested in environmental issues. And this project combined the two, and here I am 19 years later doing that. I think one of the great benefits that I found of this research is the ability to mix the basic science and the experimental clinical studies, because we often talk about translational science, but we've had the opportunity to do some, and these have been our most impactful studies and the most fascinating as well. And I think that's made the biggest headway in the field, certainly from our perspective as well. So how have I seen things change? I'm really pleased to say now that there's a lot more awareness on air pollution. It's moved right up the political agenda, and that's great. And I think the one thing that gives me hope is probably that. I think people are finally listening. I think people have made it clear that they care. So we have organisations like the World Heart Federation, and in my country, the British Heart Foundation, and they took on this huge subject where it wasn't perhaps so popular. And they were really passionate and committed to change, and they've done a great job at advocacy in this area as well. But the people are speaking as well. We now have primary school projects where we have children knowing what PM 2.5 is, even if their parents don't. And that, I think, is reassuring. And I think the public has thrown down the gauntlet, and it's up to the policymakers not only to listen, but to do something about it. And I think really here's the opportunity here. I've talked about all these awful figures and all these awful statistics, but by the same token, we do know some of the solutions for air pollution, like non-fossil fuels, fossil fuel non-proliferation treaties, for example. That's something we recommend in the report. So if we can try and get rid of air pollution, hopefully that also means that we'll follow the huge benefits in health. So if we take bold action on air quality, hopefully all our lives will be improved and we'll see better heart health.
Fascinating. I'm so glad that you took up that job all those years ago and stayed in the field, because we've definitely benefited from all the work you've done. And I think also what I'm taking away from this conversation is we really know enough to act, and we also know where to act. And what you just said about taking bold air quality action, and that's going to really improve air quality, improve heart health, but also improve quality of life for lots of people around the world. So thank you so very much, Dr. Miller, for joining us today, for all of your fantastic work. We really appreciate it. And once again, really happy that you were able to join us just ahead of the World Heart Day. Hopefully there will be a lot more dialogue, discussion, and action, most importantly, on air pollution. And we also look forward to hearing about your future work. So thank you very, very much. And folks, if you're listening live, thank you for listening and thank you for joining us. Do check out the World Heart Federation report. You'll learn great things about air pollution and heart health, and also about actions that can be taken at a variety of levels. And we will be back on October 17th. We're deviating a little bit from our 7th, but we're trying to stay with the 7 as much as possible, when we're going to talk with Dr. Sarah Adar, who's based here in the US, about children's health, air pollution, and how changing school buses can be useful in improving air quality. As always, if you have ideas for guests or topics, get in touch. Until then, stay safe. Thank you very, very much.
Thank you.